Hello and welcome to Epsom Health Limited, UK. Today we will be discussing how to manage hay fever using the latest health information. If you are new to our channel, please like, share, and subscribe to support us create more health-related videos. This has all been made possible because of your unwavering subscription and support. According to the NHS website, UK, www.nhs.uk/conditions/hay fever/hay fever is usually worse between late March and September in the UK, especially when it's warm, humid and windy. This is when the pollen count is at its highest. Symptoms of hay fever include sneezing and coughing, a runny or blocked nose, itchy, red, or watery eyes, itchy throat, mouth, nose, and ears, loss of smell, pain around your temples and forehead, headache, earache and feeling tired. If you have asthma, you might also have a tight feeling in your chest, be short of breath, wheeze and cough. Hay fever will last for weeks or months, unlike a cold, which usually goes away after 1 to 2 weeks. How to treat hay fever yourself? There's currently no cure for hay fever and you cannot prevent it. But you can do things to ease your symptoms when the pollen count is high. Just put Vaseline around your nostrils to trap pollen. Wear some wrap-around sunglasses to stop pollen getting into your eyes. Shower and change your clothes after you have been outside to wash pollen off. Stay indoors whenever possible. Keep windows and doors shut as much as possible. Vacuum regularly and dust with a damp cloth. Buy a pollen filter for the air vents in your car and a vacuum cleaner with a HEPA filter. Try to stay at home and avoid contact with other people if you have a high temperature or you do not feel well enough to do your normal activities. Do not dry clothes outside, they can catch pollen. Do not let pets into the house if possible, they can carry pollen indoors. You can get more tips on managing hay fever from Allergy UK. A pharmacist can help with hay fever. They can give advice and suggest the best treatments, like antihistamine drops, tablets or nasal sprays to help with itchy and watery eyes and sneezing, a blocked nose. Treatments for hay fever from a GP/family doctor. Your GP might prescribe a steroid treatment, such as a steroid nasal spray. If steroids and other hay fever treatments do not work, your GP may refer you for immunotherapy. This means you'll be given small amounts of pollen as an injection or tablet to slowly build up your immunity to pollen. This kind of treatment usually starts in the winter about 3 months before the hay fever season begins. Immunotherapy is a specialist service that may not be available everywhere. Antihistamines. Antihistamines are medicines often used to relieve symptoms of allergies, such as hay fever, hives, conjunctivitis and reactions to insect bites or stings. They're also sometimes used to prevent motion sickness, to treat feeling sick, nausea, or being sick, vomiting, and as a short-term treatment for insomnia. Most antihistamines can be bought from pharmacies and shops, but some are only available on prescription. There are many types of antihistamine. They're usually divided into 2 main groups. Antihistamines that make you feel sleepy, such as chlorpheniramine, Piriton, cinnarizine, diphenhydramine, hydroxyzine and promethazine. Non-drowsy antihistamines that are less likely to make you feel sleepy, such as acrovastine, cetirizine, fexofenadine and loratadine. They also come in several different forms, including tablets, capsules, liquids, syrups, creams, lotions, gels, eye drops and nasal sprays. There's not much evidence to suggest any particular antihistamine is better than any other at relieving allergy symptoms. Some people find certain types work well for them, and others do not. You may need to try several types to find one that works for you. Non-drowsy antihistamines are generally the best option, as they're less likely to make you feel sleepy. But types that make you feel sleepy may be better if your symptoms stop you sleeping. Ask a pharmacist for advice if you're unsure which medicine to try, as not all antihistamines are suitable for everyone. How to take antihistamines. Take your medicine as advised by the pharmacist or doctor, or as described in the leaflet that comes with it. Before taking an antihistamine, you should know these points. How to take it, including whether it needs to be taken with water or food, or how to use it correctly, if eye drops or a nasal spray. How much to take, the dose. This can vary depending on things such as your age and weight. When to take it, including how many times a day you can take it and when to take it. Some types should be taken before bedtime. How long to take it for. Some types can be used for a long time, but some are only recommended for a few days. What to do if you miss a dose or take too much, overdose. The advice varies depending on the exact medicine you're taking. If you're not sure how to take your medicine, ask a pharmacist. Like all medicines, antihistamines can cause side effects. Side effects of antihistamines that make you drowsy can include sleepiness, drowsiness, and reduced coordination, reaction speed and judgment. Do not drive or use machinery after taking these antihistamines. Dry mouth, blurred vision, difficult in passing urine. Side effects of non-drowsy antihistamines can include headache, dry mouth, feeling sick. Drowsiness, although this is less common than with older types of antihistamine. Check the leaflet that comes with your medicine for a full list of possible side effects, and advice about when to get medical help. If you think your medicine has caused an unwanted side effect, you can report it through the yellow card scheme. Taking antihistamines with other medicines, food or alcohol. Speak to a pharmacist or GP before taking antihistamines if you're already taking other medicines. There may be a risk the medicines do not mix, which could stop either from working properly, or increase the risk of side effects. Examples of medicines that could cause problems, if taken with antihistamines, include some types of antidepressants, stomach ulcer or indigestion medicines, cough and cold remedies that also contain an antihistamine. Try not to drink alcohol while taking an antihistamine, particularly if it's a type that makes you drowsy, as it can increase the chances of it making you feel sleepy. Food and other drinks do not affect most antihistamines, but check the leaflet that comes with your medicine to make sure. Most people can safely take antihistamines. But speak to a pharmacist or GP for advice if you are pregnant or breastfeeding, are looking for a medicine for a young child, are an older person, are taking other medicines, have an underlying health condition, such as heart disease, liver disease, kidney disease or epilepsy. Some antihistamines may not be suitable in these cases. A pharmacist or doctor can recommend one that's best for you. Loratadine is usually recommended if you need to take an antihistamine in pregnancy. Loratadine or cetirizine are usually okay to take while breastfeeding. Always check the leaflet that comes with your medicine, to see if it's safe for you before taking it or giving it to your child. How antihistamines work. Antihistamines block the effects of a substance called histamine in your body. Histamine is normally released when your body detects something harmful, such as an infection. It causes blood vessels to expand and the skin to swell, which helps protect the body. But in people with allergies, the body mistakes something harmless, such as pollen, animal hair or house dust, for a threat and produces histamine. The histamine causes an allergic reaction with unpleasant symptoms including itchy, watering eyes, a running or blocked nose, sneezing and skin rashes. Antihistamines help stop this happening if you take them before you come into contact with the substance you're allergic to. Or they can reduce the severity of symptoms if you take them afterwards. Thank you for your company today, and please do share, like, subscribe to our Epsom Health Limited, UK, channel, as we rely on your support to put all this information through our videos. Let us know if there are any particular health topics you would like us to research and provide the latest findings.